If you're on Medicare right now, you've probably noticed something frustrating. Your costs keep going up, premiums, drug plans, out-of-pocket expenses, and what makes it worse is this: almost no one ever explains why. You hear headlines, you hear excuses, but no one actually connects the dots. In this video, I'm going to do exactly that. Not with politics, not with scare tactics, but by walking you through the real structural reasons Medicare keeps getting more expensive and why this isn't a short-term problem. Once you understand what's happening underneath the surface, the changes you're seeing will finally make sense, and you will be better prepared for the future of Medicare. Nobody likes to say out loud, but here's the uncomfortable truth. Medicare costs are not rising because of one bad year or one policy change or one insurance company. They're rising because multiple long-term pressures are stacking on top of each other at the same time. And once those pressures exist together, prices don't stabilize, they reset higher. Let's start with the biggest force of all. The aging population is not a theory, it's a math problem. The population of the United States is aging rapidly. It's a problem we share with every developed nation. Every single day, more baby boomers move into higher medical utilization years, years where they need more medical care than the year before. More chronic conditions, more prescriptions, more specialists, more diagnosis, and more ongoing care. This isn't waste, it's not fraud like we've talked about in previous videos, it's biology. Healthcare demand accelerates as people move through their 70s and 80s. And here's the key point most people miss. Even if prices stayed flat, total healthcare spending would still rise because medical utilization per person keeps climbing. That alone puts pressure on every part of Medicare. But now let's talk about what that does to insurance companies. Insurance companies don't set healthcare prices. They spread the financial risk of major medical events. And when medical usage rises faster than your premiums were designed for, profitability collapses. And that's exactly what we're seeing now. Medical loss ratios are rising. That means a larger percentage of premiums goes directly to paying other people's medical bills. So I want to pause for a moment and make certain I stress this statistic carefully. This statistic is specific to Medicare-related insurance. I'm not suggesting the same is happening with under 65 health insurance. An aging demographic has little impact on health insurance for the under 65 population. For Medicare supplement plans, on average, 85 to 90 cents of every dollar that you pay in premium goes to pay other people's medical bills. The insurance company then is left with 10 to 15 cents per dollar to operate, to pay salaries, to pay overhead and commissions. And this is up from 75 cents per dollar just 8 years ago. For Medicare Advantage plans, the average loss ratio is slightly higher. So margins are shrinking and insurance companies are responding the only way they can. They're cutting benefits, they're raising premiums, they're tightening networks, and they're exiting unprofitable markets entirely. So that's not a theory, it's happening now in real time. Major carriers are pulling out of counties. Some are dropping PPOs, others are leaving Medicare lines of business altogether. 75% of the insurance companies that offered Medicare Part D in 2025 exited the market as of January 2026. Almost a dozen insurance companies have exited the Medicare supplement market in just the past few years, and approximately 80% of all Medicare Advantage plans purchased for 2026 can be attributed to just 3 companies. This is what margin compression looks like. Now let's talk about original Medicare itself. Medicare Part B and Medicare Part D are not designed to cap costs for beneficiaries. They're designed to remain solvent. As healthcare costs rise, premiums and deductibles adjust upward automatically. There's no mechanism that says stop increasing costs because retirees are on fixed income. And that's not a flaw, it's literally a design. So when healthcare inflation runs hotter than general inflation, Medicare absorbs it and automatically passes it through to the beneficiaries. That's why Medicare behaves different than grocery prices or utilities. Many retirees assume Social Security COLAs, cost of living increases, will offset Medicare increases. They don't. Social Security COLAs are based on inflation measures that reflect working households, not retirees. Medicare reflects medical inflation, technology expansion, medical utilization growth of the population, and provider reimbursement trends. Those two systems are not well synchronized. So year after year, a larger share of your Social Security increases gets absorbed by healthcare. Sometimes all of it, sometimes more than all of it. That's why so many retirees feel like they're running in place and falling behind. Now, we need to talk about prescription drug coverage, I mentioned earlier. So recently, the Medicare Part D catastrophic threshold dropped dramatically, and that's your maximum out-of-pocket risk. The Inflation Reduction Act dropped it from roughly $8,000 per person per year to $2,100. That sounds like great news, and for beneficiaries who hit catastrophic coverage, it is, but here's what's not being discussed. It tripled the insurance company's average cost per enrollee. Cost per person increased 300% in 1 year. That change shifted a massive amount of financial risk directly onto insurance companies. In addition, insurers now pay far more of the drug costs far earlier in the plan structure. And that change was set without insurers being consulted on pricing feasibility. And when that happened, insurers have really only three choices. They can raise premiums, can reduce benefits, which they can't really do on a Part D, or they exit the market. That's why 75% of the Part D insurance companies that offered Part D in 2025 have exited the market for 2026. Those that remain increased prices and stopped working with independent agents to save on commissions. And when you're losing money on every product sold, you can't make up for it by increasing quantity. And that's one of the biggest contributors to the Part D premium and the price volatility that we're seeing now from 2025 to 2026. Let's talk about Medicare Advantage. Despite what you may hear, Medicare Advantage, of course, is not collapsing, but it is repricing reality. Carriers are dealing with higher medical utilization, lower profit margins, reduced quality bonuses, the revenue from Medicare itself, and increased regulatory pressures on their coding scrutiny. Per my previous video showing insurance companies are no longer getting away with fraud. And if you missed that video and the $556 million settlement on insurance company, one particular insurance company paid, check out the video linked above my left shoulder and in the show notes below. Anyway, the response from insurance companies has been predictable. Plans are exiting unprofitable markets. Of those that exist now, the networks have narrowed, the benefits have been trimmed, and many Medicare Advantage policyholders will be shocked by the next reduction of benefits in those plans that are offered for 2027. And some insurers, of course, are leaving the Medicare Advantage market altogether. Enrollment may continue to grow nationally, but the plan richness is declining, and the trade-off between a Medicare Advantage and original Medicare is shifting because Medicare Advantage, we call them the shiny objects, the dental plans and the gym memberships and all of that are shrinking considerably. If this is helping you understand what you're seeing in your own Medicare plan, please take a second to like this video and subscribe. It helps this information reach people who need it most, and helps the channel by showing YouTube, that this is a video worth sharing with others. In addition, the follow-up video to this one will provide you with reliable government estimates of your future costs next year and each year for the next 10 years. So you'll want to subscribe so you don't miss that. Knowing those estimates will give you quite an advantage in the years ahead. And without them, well, each year is going to be a negative surprise. All right, let's talk about Medicare supplement plans and the birthday rule problem. So several states, many states, have expanded or implemented birthday rules in the last year or so. And the birthday rules are a guaranteed issue window. Now, on the surface, this sounds consumer friendly, and it maybe in some cases it is, but here's the actuarial reality. When insurance companies must accept applicants regardless of health, healthy policyholders end up subsidizing the churn. And this is exactly the same problem that we've had with Obamacare that has resulted in that entire concept to be one of the very most expensive mistakes in all of healthcare. But with Medigap plans, there's no government subsidy. You and I and all of us pay the higher prices because of the government interference. So what happens? People switch plans when it benefits them most every year. Insurers, the insurance companies, lose the long-term pricing stability and long-term pricing strategies, and premiums must rise substantially to offset that risk, in addition to increasing for inflation. If prices can't rise fast enough, insurance companies exit the market, and we've already seen that happen. The combination of aging demographics and birthday rules is why Medicare supplement plans are rising faster in price in certain states, and why your insurance carrier choice is shrinking. The number of insurance companies offering Medicare supplement plans has declined meaningfully in the past 3 to 4 years. At this point, the pattern should be clear. Rising per-person medical utilization, regulatory pressures and law changes that were not well thought out, margin compression, forced risk absorption. When all of that stacks up, insurers don't absorb losses forever. They leave and they raise prices, and that's why you're seeing fewer plans, fewer carriers, and fewer options in many areas. And it's not because Medicare is failing, it's because the pricing reality is being reestablished. So here's the takeaway. Medicare costs are rising faster than almost everything else because the forces pushing them higher are structural. They're demographic, they're mathematical, they're baked into the system. And this doesn't mean that Medicare is going away. It means that beneficiaries must stop expecting price stability where none exists. The real risk isn't rising costs, although that is a risk to many of us. The risk and the harm comes from being surprised by them when you can't and you don't plan for those rising costs. And one year they take you by surprise and push you over the edge where you can't afford it anymore. If you choose a Medicare supplement, plan for rising premium rates as you age. If you choose a Medicare Advantage plan, plan for decreased benefits and increased maximum out-of-pocket financial risk as you age. If you've experienced premium increases, benefit reductions, or plan exits in your area, I'd like you to tell me about it. I want to hear your story in the comments below. I'm interested in what you have to say. Your real-world experiences actually help other listeners understand that they're not alone, and they help guide me, and they help give me ideas for future videos on this channel. This video wasn't meant to scare you. It's meant to prepare you. You can't control healthcare inflation, aging demographics, or Medicare's design, but you can control how you plan, how you choose coverage, and whether rising costs catch you off guard. And this is what we do for our clients. This is the value we add to earn your business. If you want clear, honest explanations on how Medicare really works, not sales pitches or headlines. Subscribe to this channel and reach out to our office at Medigap Seminars for personalized consultation at no cost to you. In an upcoming video, I will show you how you can use Medicare's own estimates to plan out your future Medicare costs up to 10 years ahead. I'm Matthew Claassen with Medigap Seminars. Thank you for watching, and I'll see you in the next video.